this is Nurse Ebony. Thank you for tuning into my channel today. I'm going to give you 8 nursing informatics jobs that us nurses typically do. Now, the 8th one is a bonus that they don't tell you about. So stay tuned. Class is in session. Okay, class, so let's just jump right in. So basically, what does a nurse informaticist do? Okay, so a nurse informaticist basically analyzes patient data to improve patient outcomes and help healthcare organizations implement technology to improve those patient outcomes. So a lot of us are behind the scenes researching, developing, and training on these patient EMRs, electronic medical records, to help implement this. Now, I did say developing, yes. Some of us do know how to code behind the scenes, okay? So our daily task may include managing multiple projects, training staff, or developing policies and procedures. The list goes on. But again, that's just one aspect of nursing informatics, but it is a broad, popular part of it. So today I'm going to give you 8 different jobs that are common that nursing informaticists do. Now, I've had most of these jobs, but there are also some jobs too that are not on this list that are a part of the nursing informaticist field, that it's so broad. So just don't think that this is the only list, okay? Now, the last one that I'm going to give you, number 8, is a bonus. So watch to the end, because a lot of people don't tell you that this is a cousin of the field. But that's a job that you can start today as a nurse. Okay, so let's take the first job. The first job is a nursing informatics specialist, okay? This job is typically at the hospitals where you are the liaison between IT and nursing staff. So you're typically working this job at a healthcare system, at a hospital, and you are helping roll out new electronic medical record systems or other technology systems to help with patient care, okay? So this job can come in multiple levels. You can have a nurse informatics specialist 1, 2, or 3, depending on your health system. Okay, so the second job is a clinical analyst. Okay, this job is more on the technical side, okay? You may need a coding experience, SQL experience, and just be a little bit more tech savvy with this one. It's not just analyzing and managing just the EMR, the electronic medical record. This is managing computer systems and networks that are part of the workflow of the healthcare system. Typically, this role is in an IT department, and there are typically technology people with computer science degrees that hold these roles, but there are also nurses that hold these roles as well. And then there's some training involved in making sure that the processes run smoothly in the healthcare system as a total. Okay, the third job is the director or manager of clinical informatics, okay? This is a job that you need years of experience. Also, they look for if you have your MSN as well. This is the position that leads the team of either analysts or informatics specialists. Usually their team is small, and this position reports directly to leadership. So you might report to the chief nursing officer and other leaders of the healthcare system. So whenever they're needing to roll out or plan on implementing different systems, it comes through that department, and then you disseminate that information to your team to get to work. Okay, so that's the director or manager of clinical informatics. You're a lot of times in a lot of meetings and helping plan so that these implementations can take place, and then you are the voice of the informatics, and you can articulate what is needed, what the informaticists can do, and what we can offer to that plan. Okay? All right. So that's the third one. The fourth one is the Chief Nursing Informatics Officer. So that is a part of the C-suite of the hospital. That is one of the executive leadership positions. You definitely do need at least your MSN to be a part of that. There's also nurse practitioners that have been a part of that with years of experience in healthcare that are a part of that role. But you oversee the entire clinical aspects of the hospital, okay? And CFOs, CIOs look to the CNO for their direction and leadership when it comes to optimizing technology to help in improving patient outcomes, okay? So that's a very important role, okay? And so they have multiple nurses and staff underneath their leadership, okay? So the next one is an informatics consultant, okay? I did that for a number of years. So basically what you do is you help to go in and solve a problem. Who doesn't like doing that, okay? So I would travel. Now a lot of these, this consulting in informatics is typically a traveling job. So you have to be in that part of your life where you are okay with traveling. So you go into different, it could be medical offices, it could be helping with go lives or starting from scratch. They're needing your services to say, hey, we're tired of these. We need to comply with regulations, and we need to stop with the paper charting, and we need electronic medical records. Where do we go? How do we start? Or it could be, hey, we have this electronic medical record, but we don't think that it is as efficient as we need it to be. What's your advice? How can you help optimize it? Can you help with training our staff? They rely on our skills to help improve their patient outcomes in their practices or their health facilities. So there are a lot of consulting companies that hire nurses for this role to be a nurse consultant, or there are some nurses that have their own consulting company and do that as well. Okay, number 6. Ready? Clinical application specialist. Okay, application specialist. It kind of tells you what you have to do, right? You are the expert in various applications, okay? So this could be a stationed position at a healthcare facility, or it could be a traveling position. If you know multiple applications, sometimes companies, a consulting company or a staffing agency will send you to different sites that need your expertise to help train on those applications. So it's always good to know as many applications as you possibly can, okay? So just not now, EMRs are a bulk of them, but there could be other applications as well that are used to deliver patient care. So, like I've said in the previous video, us nurses have a lot of superpowers that we don't even know about. We use multiple applications throughout the day. And if you are tech savvy and if you're good with using these applications, you're adding to your tool belt to where you're becoming more proficient on using these, and you know the best way to optimize them and use them in a patient care setting, because that's what you do every day. So a clinical application specialist does that. They are experts in various applications, so they help to train on that, and they also help with the implementation of it and optimizing it behind the scenes to make it even more efficient. Okay, so next, number 7. It is a nurse educator, a nurse informatics educator, okay? So typically, this position is at a university college setting. You at least need your MSN in Nursing Informatics or MSN in Nurse Education for this role. You need educated nurses that have their MSN to teach the next generation. Okay, so this is a role to where you at least need an advanced degree. So you're either teaching remotely or in a classroom setting, helping and teaching students on the benefits and the role of the nurse informaticist and how we help improve patient outcomes. Okay, that's such a rewarding field to teach in the next generation. So the last one is a bonus. You don't hear a lot about this job whenever you're searching for nursing informatics jobs, but I think that it is a cousin of nursing informatics. Now, not a distant cousin. I believe it's like a first cousin, okay? Very close, like right there on the edge to the nucleus of nursing informatics. It's called a Data Abstractor. I know. Yeah, a Data Abstractor. That's a very important role. Now, it's not the highest paid job, okay, but it does kind of give you insight on if going into the field of nursing informatics might be of interest to you. But it might not be like one of the highest paying nursing informatics jobs, but it's a very important role. And to help improve patient outcomes and the best practices of patient care and the best medicines to help with patients, you need data pulled from one system to go into another system so that it can be analyzed. And behind the scenes, data abstractors do that. Now, there are many different types of data extractors. Some of them you do need your certification. For example, a CTR. That stands for Cancer Tumor Registrar. Yes, you do need a certification for this. But once you get that, you can abstract, work from home, and you can live in one state and abstract for a company in another state, okay, as long as you have that certification. Another one is get with the guidelines. GWTG. Get with the guidelines, okay? That is also an abstraction role that you need a certification for. Also, HEDIS, HEDIS. That's another one. But a lot of these data abstractor roles are looking for nurses that have experience in a particular specialty. So it could be a cancer specialty that you have an experience in and that you're good with using technical systems and you don't need a certification. Or it could be, hey, you're good with pediatrics, you have experience in peds, and they need your skills with that. So it depends on your specialty, but there are some abstraction roles that you do not need a certification for and that you can start applying for today that can get you kind of in the family of nursing informatics, and then see if you would like to explore it even further. So I hope this helped you today, class. I love talking about this. And again, subscribe to my YouTube channel. Also, check out my ebook. Okay, this can give you more and more details on what nursing informaticists do. Okay, so thanks for tuning in, everybody. See you next week. Bye-bye. Class is dismissed.